Hello and welcome to Surgical Simulation 3209. The purpose of this presentation is to introduce you to some of the concepts you'll need before arriving to the simulated experience. So let's go ahead and get started. The goal of this course is to provide you with an authentic, interactive experience that prepares you for the role of an RN in the surgical environment. The environment will be one that facilitates collaboration, encourages questions, and explores mistakes in an open and welcoming way. The key words there are open and welcoming. We want this to be an experience for you that is positive and promotes learning. We do not want to put you on the spot so that we can see what you don't know. We want to emphasize what you do know, explore some of the mistakes, and do it in a way that is fun and interactive. So if you're nervous, it won't be a big deal. Just come prepared to participate. I'm going to go ahead and introduce you to your patient ahead of time because research shows that if nursing students are given a realistic story for the mannequin that they'll be working with, it feels a little more real. They're more likely to participate and act like it is a real situation. So this is your patient, Miss Ruth Livingston. She's an 80-year-old white female, active older adult who enjoys sunbathing on her front porch and shoe shopping at the mall. She lives alone but has a son who lives out of town. She's an active volunteer and member in the community, serves at Manna House Soup Kitchen and Southeast Georgia Health System gift shop. Her medical history is osteoporosis, hyperlipidemia, and occasional migraines. She can be seen here sunbathing and seen here shoe shopping. So here's the accident. While trying on a pair of designer Gucci shoes, Ruth slipped and fell. An ambulance was called to the mall and she begrudgingly agreed to go to the emergency department. X-ray revealed that she had a right hip fracture and she was admitted to the surgical floor. You will work with her as she travels through the preoperative, intraoperative, and postoperative environments. She can be seen here in the emergency department. So let's discuss some of the classifications of surgery you may encounter. There's elective, urgent, and emergency. An elective surgery means if for some reason the client fails to have surgery, it's not catastrophic. It needs to be done, but it's not an emergency, and if it doesn't get done, it's not a huge deal. Urgent means it doesn't have to be done immediately, but it should be done within 24 to 30 hours. And then emergent means it should be done without delay. It's an emergency, go ahead and have it done. Based off this information, can you guess which category that Miss Ruth Livingston's right hip fracture would fall into? If you guessed urgent, you will be correct. Let's go ahead and introduce you to the surgical team members you may be working with in the perioperative environment. There's a circulating nurse, and some of the roles of a circulating nurse include admitting a patient to the operating room, checking the equipment, and pretty much coordinating all the activities in the room with the other various team members. You also have a scrub nurse that may gown and glove self and other members of the team, pass instruments to the surgeon or the assistants, prepare the table ahead of time. Those would be some of the roles of a scrub nurse. Your surgeon would be the one who does the actual surgery, chooses which surgical procedure is appropriate, and then manages the patient during that surgery. The RN first assistant works with the surgeon and assists with the hemostasis and the suturing. So think of it like a right-hand man to that surgeon, right there assisting through that process. And then another hot topic right now are CRNAs, which are certified registered nurse anesthesiologists or anesthetists, and some of the roles that you may see them performing would be the maintenance of the homeostasis during surgery. They may also supervise the post-anesthesia recovery time of the patient in the PACU, and they administer anesthesia under the supervision of a physician. So that's just a really quick breakdown of some of the roles. There are several important concepts to know when working in the surgical environment. We're just going to cover the basics here because you will have this experience during the simulation event. So the attire, you've probably seen the people walking around the hospital with the green scrubs. Those are most of the time going to be from the OR or somewhere in that environment, the PACU. The reason they wear the scrubs with the hats and the shoe covers, if you go back to fundamental, it's all about keeping that clean, safe environment for the patient. They do not wear their scrubs into the hospital as other nurses do because you don't want to bring anything from home into the OR. And the same goes for, you don't want to bring anything from the OR such as superbugs and things home. Gowning, scrubbing in, sterile technique, that's all concepts covered in your fundamental course, but you do need to go back and review those if you're not confident still with them, because they're important, crucially important when dealing with patients in the surgical environments. You need to make sure you know how to gown up appropriately, and you need to make sure you can take that gown back off without spreading germs and keeping yourself clean and sterile if need be. Scrubbing in, some places are using the alcohol scrubs now. We'll discuss that more in your intraoperative portion tomorrow. Sterile techniques, again, it doesn't only apply to gloves, but it applies to equipment. So go back and review that. If you throw a syringe in the middle of a sterile field that is not sterile, the sterile field has been contaminated. That's a good place to bridge off into ethics. There's something called a surgical conscience. A sterile conscience when dealing with a surgical environment. Meaning if you see that something has been contaminated, it is your responsibility as a professional to point that out. Where the ethical dilemma comes in is that sometimes it may have taken several hours to prepare that OR room for a patient just to find out something's been contaminated and you have to start all over. That puts the patient at risk, that also pushes other surgeries back, but it still comes down to the fact that it is a responsibility and a very critical one to maintain your patient's safety. Informed consent, you will do a piece of this in your preoperative simulation. Review some of your facts on informed consent. We as registered nurses witness the informed consent for the patient, but it is not our responsibility to educate them on the actual surgery. That is up to the surgeon. Now we can tell them some expectations and clarify some things, but they need to make sure they understand that surgery completely before they sign the informed consent. And if they do not, that surgeon must come back and clarify prior to them signing and you being a witness. Antibiotics are very important. Most facilities have policies saying they need to receive some kind of prophylactic antibiotic prior to going to surgery patients, so you need to make sure that gets done when you're in that setting. A lot of times it's an hour before incision time. So if that's late or not given, you can see the implications that may have for patient safety. Safety for your patient is important, but also for yourself when in the surgical environment. You have to think about a lot of equipment you'll be using, possible needle sticks, cauterizing equipment. So you have to maintain your safety as well. And then of course assessment. It is crucially important for patients in these environments, because there's several things we need to know prior to going to surgery. If they have some kind of musculoskeletal impairment, we need to know that for positioning. If their shoulder can't go over their head, we must know that if they're having a shoulder surgery and the other arm must be put behind their head. Allergies, are they allergic to any of the betadine or iodines that we use to prep the skin? Are they allergic to the antibiotics they need to get? We need to know that ahead of time. Any piercings, if they're going to MRI, we need to know about those piercings. Dentures, implants, pre-op medications that make their blood thin or make them clot, any hair that has to be removed ahead of time. These are all things that are important to note prior to them getting to the OR so they can be addressed and handled appropriately. So let's talk about the phases of surgery you'll encounter during the simulation course. They're preoperative before, intraoperative during, and postoperative after surgery. This is your preoperative simulation. I'm not going to read through the whole thing for you, but I do encourage you to go back and read this, because these are the goals that you'll encounter during the simulated event and things that you need to be prepared to do when entering. There's a report at the top of your patient, and then the goals are below, things that we want you to try to accomplish while you're in that simulated scenario. The intraoperative simulation will discuss sterile techniques, scrubbing in, positioning, safety, equipment, and you'll participate in a timeout event, which should be a lot of fun. In your postoperative simulation, once again, you'll go into the simulation lab. There's a report for you waiting, along with goals. So review those ahead of time and be prepared for that to kind of be the way that you flow through the simulation. As a last and final note, This course is not meant to intimidate you or cause you anxiety. I know I said that in the beginning, but I need to repeat it. You'll participate in simulation scenarios not to test your ability to practice, but to strengthen it. We want you to succeed. Please come motivated to learn and participate. Review Miss Livingston's story and the simulation goals above prior to arriving on Tuesday, April 29th, 2014 at your assigned time. I look forward to working with you and hope it will be a great learning experience. Have a great afternoon.